Yesterday was the deadliest day in New York with more than 700 coronavirus deaths, but there are also signs that this disease is starting to plateau a bit in the state. NBC News correspondent Tom Winter joins us now. And Tom, there were some glimmers of hope from Governor Andrew Cuomo today. What's the latest on the outbreak here in New York?
Yes, there were some glimmers of hope today, Allison, and you know, it's hard and it seems uncomfortable to say that on a day where the death toll increases by over 700 people, but that's typically a trailing indicator, and what the governor talked about today are kind of some of the leading indicators that there might be some signs for hope. Let's take a listen.
We talk about the apex, and is the apex a plateau? And right now we're projecting that we are reaching a plateau in the total number of hospitalizations, and you can see the growth and you see it starting to flatten. Again, this is a projection. It still depends on what we do, and what we do will affect those numbers. This is not an act of God that we're looking at. It's an act of what society actually does.
So, Allison, one of the things that he showed, and we saw it at the tail end of the clip there, is not only are the overall hospitalizations starting to trail off, but also the amount of people that are being admitted into the ICUs and are being intubated. Of course, that involves the use of those ventilators that we've been talking about so much over the last 2-3 weeks. So not only is it just that less people are coming to the hospitals, but the growth rate for the amount of people that are most seriously sick, that is also starting to trail off, and that's also a good sign, Allison.
Tom, we know when the governor talks there, he's talking about New York State as a whole. Is the city tracking along with the rest of the state in terms of cases and hospitalizations appearing to slow down in the 5 boroughs as well?
Yes, Allison, and that's also a bit of a good news as well. So we've been looking at some charts and some data that's been provided by the New York City Department of Health. And basically, they've been looking at a couple of different things. And this allowed them to get a little bit of an indication that they may have a serious problem with coronavirus back in early March. So it's something that they use as kind of a little bit of an early warning system. And essentially, Allison, what it says is it says that hospitalizations in New York City have peaked a couple of days ago, came down a little bit, came back up, but what we're not seeing is them make these big moves higher. And that's really important. That speaks to some of that plateauing that the governor is speaking about, the flattening of that curve. So while we may have some days where we go up a little bit more than the day before, we may have a day where we really go down from the day prior as far as the growth in hospitalizations. Right now, we're not seeing anything kind of spike over where we have been. So that's a really good sign. Obviously, the ultimate sign, what we'd like to get to, is where we don't see any more hospitalizations tied to COVID-19. That seems like something that's not in the immediate future, however, but at least we're trending in the right direction, Allison.
Well, Tom, I will say it has been a tough time in New York, but you just provided us with 2 glimmers of hope, and we will take both of them these days because that's pretty impressive in these times. So thanks for that. We could use all the positivity we can get. I would love to ask you about the city fire department. A spokesperson for the FDNY says that more than 1,300 EMTs, paramedics, and firefighters are back at work. More good news after they tested positive for or were exposed to COVID-19. Do we know how many members of the FDNY actually tested positive for the virus?
Right. So, Allison, it's 543 that have tested positive so far for the coronavirus. Now, of course, that's not all of the firefighters. I'm including EMTs. I'm including in that total firefighters as well as civilian members. As we know, for the most part, testing in New York City has been limited to those that have been hospitalized. So that's not a full scope of however many people have had it. But, you know, just briefly back to the glimmers of hope there, when you have 1,300 plus people return to the job that believe that they've had it, one, you're adding back manpower because we're still about 1 out of every 4 EMTs are out sick. So that's really important at this time, right? And then the second thing about it is there's a good chance that most of those people are now immune to this. So they can go out and they can work these various 911 calls and they can interact with these patients knowing that they're going to be okay, they're going to be safe, and they're going to remain on the front line. So kind of a 2-point win there, if you will, Allison.
Tom, Tom, you just keep hitting us with good news. That's fantastic. I would like to ask you another heavy question, though. We know emergency calls in the city are just at record numbers recently. You looked at some of the figures for cardiac cases. What have you seen there?
Right. So the FDNY's data analysis team is always pouring through their data, trying to pick up on any particular trends to either anticipate what they're going to need with that PPE, those masks, those gowns that we've talked so much about, but also to get a little bit of a better understanding of the enemy that they're kind of fighting here. And in this case, obviously, it's coronavirus and COVID-19. One of the things they started to look at is they said, OK, let's go back to March 20th of last year through last Sunday, and then look at that period, and then the same period this year. Let's look at cardiac calls and cardiac calls with flu-like symptoms. Now, these are the most serious calls. So this means when the EMTs and the paramedics show up, somebody either is so obviously in distress that they need to get CPR, to have the defibrillator right away, or they're in a case where they're obviously dead. There's some certain signs of that. It's very macabre, I understand, but that's what they're looking for. When you look at that data, about a year ago, they're averaging 69 to 70 cardiac calls a day. Somebody who is either dead or is maybe having a heart attack. And then they looked at those same amount of calls this year, which have averaged close to 200 in the last 7 days. It's pushed almost 300 of those calls. So you're increasing 3 to 4 times in those calls. But most importantly, about a year ago, they were saving about 60% of those people. They were able to resuscitate them. They were able, they were in good enough shape that they were able to get a pulse back, at least get those people to the hospital. Now we're pushing 70%, and on Sunday, 75% of those cardiac calls that they went out to, the person was not able to be resuscitated or was obviously dead, and there was no chance of any sort of attempt of resuscitating that person when they got there. So what does that tell us? What it tells us is that the calls were up 3 to 4 times for people in cardiac arrest, and it tells us the 7 to 9 times the amount of people of normal were not able to be saved, were not even able to be taken to the hospital despite the best efforts of EMTs. It tells us there's an awful lot of very sick people in New York City, and it tells us that an awful lot of those people are in bad shape by the time the ambulance is called and it shows up at the door, Allison. So difficult information to get. Obviously, it's not all COVID-19 cases, but it gives us a real big sense of why those call numbers that you referenced are up so much and why we're hearing so many of those ambulances throughout this city.
Yeah, a tough time in New York on a lot of levels. Tom Winter, thank you so much.
Sure thing.
Doctors and nurses on the front lines of the coronavirus pandemic are risking their lives every single day. A registered nurse shows us what her first few days were like working at the temporary hospital in New York Central Park.
So the ladies that I'm walking over with, we have been a lot of places in the world together responding to disasters. Ecuador after the earthquake, Haiti after the Hurricane Matthew a few years ago, and even Iraq in a war zone. But we have never been responding together in America to a disaster situation. So this is a first for us. Definitely hits a little different. We've been getting the question of if we're afraid. Yeah, I don't think any of us are necessarily afraid. While there are questions about it, this isn't our first time responding to an infectious disease, and so we all feel safe. We had our training yesterday on what all of our PPE is going to be like. We feel very confident in that. So right now, I think it's more like, I don't know, what would you say, anticipation that we feel? Yeah. Versus fear. So we're just excited and anticipating being able to put our skills to good use to serve the great people of New York City.
And so we just received our first patient here in the ICU. So we got her all settled, doing well. We just wanted to update you guys on the fact that we still
First day with patients. I am tired walking back to my room right now, but it was a good day, learned a lot. COVID is very different than anything I've ever treated, really. They look fine sometimes, but then you look at their vital signs and they don't look fine. So we're still learning the new normals with their oxygenation and what to do, how to treat it, what's best. But overall, a good day. Handled a couple of emergencies because these patients can go bad really quickly, which is why I think it's so dangerous.
So we had a rough day today with some rough patients and really difficult decisions. So that was just a lot of what the day encompassed, us coming together as a team, trying to figure out what's best, how to treat, where not to treat, and how to best support families and patients. So prayers for that would be great. And prayers for our patients and the people of New York. Yeah.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.